Thank you and good morning to all. Really a stunning display of community participation, engagement, and interest that people can give up their Saturday in an August summer month to be here this morning. So it's really certainly warms our heart at the California Endowment to see this much community support, engagement, and participation, and a one-clap acknowledgement of applause for Supervisor Ridley-Thomas and his team. So I'm even giving you 3 or 4. I have 2 roles. One is as President and CEO of the California Endowment, and we've been an investor in South Los Angeles to improve the health of that community. Also, I chair the Health Transition Task Force for the supervisor, and what you are seeing and hearing today is an overview of how South Los Angeles goes from worst to first in terms of a healthcare model for the nation. Okay? So this is a historic moment. It only becomes a historic moment if we actually deliver the results that the supervisor mentioned, right? But things are moving, and I've seen a greater sense of optimism and hope and energy and strategic action than certainly in the 9 years that I've been here in Los Angeles. The 4 pillars to going from worst to first as a national model of healthcare. And the statistics show that South Los Angeles has indeed the worst health status indicators of any community in the region. And in fact, when you combine the capacity of the healthcare system and its infrastructure, hospitals, emergency rooms, clinics, specialty care, with the statistics about poor health, one could make the argument that this is ground zero for the nation's health problem. That South Los Angeles is the place where we have to begin to turn the country around. In our view, and Supervisor, and I certainly agree on this point of view, and many others, 4 things have to happen. You've heard about them. Let me just summarize them again. Number 1, the reopening of Martin Luther King Hospital Medical Center. A must, has to happen. Number 2, the resurgence of Drew University as a leader, and in the reestablishing the Drew King-Drew partnership. Number 3, you've heard it before from Dr. Flores, the establishment of a new integrated model of healthcare. When we use that term integrated, what we mean is instead of separate entities not functioning together on behalf of families and communities, we mean acting as an integrated parts of a whole, okay? Specialty care, primary care, clinics, prevention, hospitals, emergency rooms, urgent care centers, all working together to serve the community. And then finally, which we haven't said enough about, but there's some notations in the packet from the supervisor's office, the importance of prevention. Prevention, prevention, prevention. Opportunities for people to eat healthy, exercise, fitness, working on young people, making sure that we're investing in prevention. The opportunities are coming out of Washington with the Obama administration, the stimulus package dollars, health information technology dollars, and also what comes out of health reform. The big problem, which I'm not sure was mentioned this morning, it may have been, the major, significant, and savage budget cuts coming from Sacramento to the health programs, and it's going to set us back. So we've got a major opportunity with the Washington opportunities and the election of Supervisor Ridley-Thomas, and we've got a real problem coming through Sacramento in terms of those resources. Our transition team will be working together over the next several months to begin seeding, constructing, nurturing, putting together, planning what an integrated delivery model looks like for South Los Angeles. We work with Dr. Flores, Jim Mangi, I saw here from St. John's Health Center, Lark Galloway Gilliam, many others. We'll be working together to make sure that we have the beginnings of what an integrated model could look like. Our foundation will be funding community health centers and primary care clinics, trying to establish and strengthen access to specialty care for people who need specialists in South Los Angeles. We know that if you're on Medicaid or on Medicare and you need to see a specialist, you may have to wait 3, 6, 9, 12, 15 months to see a specialist, which is unacceptable. So we're moving forward. We are an investor in the private sector investment. in this community. We have a greater sense of optimism today than we did certainly 1 year ago. I want to thank Supervisor Ridley-Thomas for his leadership. I also want to thank and acknowledge the leadership and support of Merv Donnelly with the nursing school at Drew University. I think I saw Mr. Donnelly here. And I also want to add and second Dr. Flores' assessment. We have a terrific interim leader, Dr. Keith Norris. Keith, I don't know where you are. I know you're in this audience somewhere. But he's going to provide excellent leadership at Drew. And we feel a great sense of optimism that with the supervisor and Bill Fujioka working from the county, those folks working from Drew, if the university steps up and does well and does right, we should be in great shape. Thank you.